How can malabsorption from the GI tract from surgery or severe diarrhea lead to excessive bruising, bleeding or ecchymosis? These patients can develop vitamin K deficiency secondary to malabsorption of fat-soluble vitamins. This leads to a deficiency of the vitamin K-dependent clotting factors. The vitamin K-dependent clotting factors are factors 2, 7, 9 and 10. The decrease of the vitamin K-dependent clotting factors can lead to prolongation of the PT with a normal PTT. However, if chronic, can lead to prolongation of both the PT and PTT. Disruption of the normal coagulation of the blood can lead to excessive bruising, bleeding or ecchymosis. Bonus trivia. The length of your foot can be estimated by measuring the length between your wrist and your elbow. FlashMed, video flashcards.